I know probably because I'm a Muslim, you probably would have been expecting Christians to come. This is my first time of being in the church, and I'm really happy to be part of you. Naturally, it is positioned in front of the chest. And normally, a breast one is bigger than the other, which is normal for every woman. This breast consists of so many other things, but we have three main tissues. We have the logos, which produces the milk in the breast. And we have the ducts. These ducts are what transfer the milk to the nipple. And then we have connective tissue. These connective tissues support the breast to stand. So most of the breast cancer that happens mainly happens in these lobes and then the ducts. So what is cancer itself? In our body we have cells, which is the basic functional unit of the body. So these cells help us to survive, but they have their lifespan. Each and every day they multiply and die, multiply and die. So cancer happens when these cells grow out of number and refuse to die. So they accumulate and they form a lump. So this is how the breast looks like. Like I was saying, the nodes are here. They produce the milk, and then the ducts, which transfer the milk to the nipple for the baby to suck. This is how it looks like. There is no one factor that causes breast cancer. It is a multifactorial thing. That means a combination of so many other things come together to form the breast cancer. Which is modifiable or controllable or what? So that means with these factors you can do something about it. Then the non-controllable factors. Something you cannot do anything about it. So let's look at the factors you can't do anything about it. Your family. You don't choose who your mother becomes, right? None of us here chooses who to be your mother. So if you are born to a mother who has breast cancer, it puts you at a greater risk of getting breast cancer in future. Then your age. You can't do anything about your age. We were all born kids and started to grow. Nobody has control as to whether to stop growing or to grow.
The Biomini Affinity Bona, American Provenia Masu, the Madachi, Nadeka
and the more you grow, the more your body is at risk of so many other things, not even breast cancer alone.
As
These cells we're talking about that keep multiplying because of the growing age, it tends to become abnormal. Then what? Your early menses. Normally, a woman is supposed to start her menses after the age of 12. But we get women who start their menses very early, so they are exposed to what we call estrogen. So the longer this estrogen is in your body, the higher what? You are at risk of getting breast cancer. Late menopause. Late menopause. How long your menses take to stop?
Okay.
Nobody has control over this. Some people stop menstruating earlier, very long, close to 60 years, and they are still menstruating. And in that case, the hormone estrogen has been in your body for so long. What is this estrogen we are talking about? It is the hormone in the woman's body that helps to prepare her body. Among the functions of this estrogen is to work on your vagina, on your womb, and any other things in your body as a woman. There is no woman without the hormone estrogen. And this estrogen serves as a fuel for cancer cells. So you understand why, as long as the estrogen remains in your body, you are at risk of breast cancer. So let's look at the things that you yourself can, that is the controllable factors, things that you can do. Childbirth. If you give birth or you get pregnant, there is this distortion in the hormone estrogen, which reduces your risk of getting breast cancer. And we know some women can decide they don't want to give birth. But actually giving birth reduces your risk of getting breast cancer. And do something about it. So when you give birth, not only the giving birth, if you give birth and you are breastfeeding, because during breastfeeding, this hormone estrogen is reduced, it reduces your risk of getting breast cancer. Eating of processed food. Most processed food has this high fat and the sodium, which is converted into estrogen and serves as a fuel for breast cancer. Lack of exercise. The more you exercise, the more you bend down fat. Yes. So if you burn fat, this fat we are talking about is converted into estrogen, which serves as a fuel for breast cancer. So if you exercise, you reduces your chance of getting breast cancer.
Ananya be enyale na mesen ya otobi wokola. Ena na be happy na ko breast cancer ya sesen Africa.
Exposure to radiation. Obesity.
Lolo chome.
When you are fat, so much fat is deposited in your body. And this same fat is converted into the estrogen we are talking about, which serves as a fuel for cancer.
Nenye be lolo chome eye ami yo kwa na me ka o me fun apa. E wo na ebe atenwa ko breast cancer ya ha.
Some people are naturally fat.
Amedo lolo kun chojojo me.
But let's exercise frequently.
Akemi na mi anola me senu wo ike na be ami ya wa watenwa no pa fian na mi ape na me ka o.
So if this cancer happens, how do you know you have it?
Anenye be cancer ya jo a leke na wo krafia nya be ededo ikwa na me.
We have the signs and symptoms. Some of the symptoms you will see, because these cells tend to become abnormal and then grow much plenty, they form the lump. So you find a lump in your breast. But not all lumps are cancerous. Yes. And then you can have some rashes on your skin of the breast. Sometimes you get the discharge. And others too, even though the breast one is bigger than the other, but you find your breast much bigger than expected. Then there's some kind of dimpling. Some people get the dimpling, the breast tends to go inside a bit at one point. So depending on all these signs, it is not all the time going to show. Some people even identify the breast cancer before they start showing the signs. That is why the need for the screening. So we are here to show you the signs and then to tell you when to report. How do you identify some of these things? You can do your own self. We will be doing the screening here, but before I end, we want to show how we do breast self-examination. In here, we'll be doing this for you, but when you are at home, how do you examine your breast yourself? First of all, you need to make sure you are not in your menses. Because when you are in your menses, the hormones are at their peak and then they just change the what? The shape and then the size, the feeling of the breast. Some will agree with me that when they are in their menses, they feel pain. And they feel their breast has somehow a little bit increased. So in that case, if you are doing this, you might not be able to identify anything normally. So get a mirror in your house. It can be done whether standing in your room or in the bathroom or when you are lying down.
Breast examination after menses, you not share we are open at the now I share roof one, our mirror new. Open said breast the same size. Why is the rashes be with one? I will be a washer, but dear, a nipple, I don't know, 80. I will say, dear, discharge biara ɛyɛ den efi mu ɛɛba ana ɛna afei so bɛyɛ sɛ bia ano ɛnyɛ kɔkɔɔ ya ne nyinaa wobɛkyɛke ne nyinaa wɔ mirror ne mu wogyina mirror ne mu na wahwɛ nti wowie a sɛ wobɛstarte examination a yɛdi kan baabi a nufu no nea woba bɛyɛ no wode saa wo nsa no sɛ left na woyɛ a wo nsa left wode bɛto w'ati po nti wode to w'ati po a na wode right one ayɛ den wode amiamia nufu no na wode amiamia wobɛyɛ ne sɛ nti wode wo nsa left sɛ woyɛ right a wode wo nsa right wobɛto w'ati po na wode wei no ayɛ den ayɛ wo nsa form sɛ na wode amiamia wobɛstarte afiri sɛ woyɛ ne circle a wobɛstarte afiri bɔtɔɔ no mu wobɛhwɛ nti wobɛkɔ ne round saa abɛsi nti wobɛsi a na afei no woayɛ ɛfifi na wowie a wobɛmia wobɛprɛsi ano no kakra na wahwɛ sɛ nsuo bi ɛbɛyɛ dɛn ɛbɛfum aba nti wowie right na afei wode wobɛyɛ left no so a wode wo nsa left no ɛno so bɛto w'ati fam na wode nsa right nsa yɛ daade apapeti left one nti woyɛ ɛno so bɛstarte saa na de aba round abɛsi na ɛno so woamia nufoɔ no ano no wahwɛ sɛ nsuo bi bɛyɛ dɛn ɛbɛfita wɔ bi a ɔma akwadaa nufoɔ di a woyɛ dɛn a nsuo bɛyɛ dɛn ɛbɛpie aba ɛno deɛ ɛyɛ normal but sɛ wo breastfeed na womia na sɛ nsuo bi ba na deɛ ɛkɔ ha wo sɛ mogya kakra koraa yɛ dɛn ɛwɔ mu ana wo mimi na wo si dia apart from aba normal ye wa aba normal ba ko e den edem but awo na ti dia fofo bi ada den abeka ho a eno no wo de betu ana mo aba na ye so aye den ya hye ni akonfirm mi emu nya se ma wo koye scan ni amo akoye na ye so ano ntem ansa na boko ha obi ade aye den abrel.
So depending on how early you report to the facility for examination, that will tell how long or how best the breast cancer can be treated.
Opecho kaba ayi de kochia yena fia bewa tim awadocho cancer yanlo aroma tim.
So by science we have 4 stages.
Ale jojo memea do pema menne ele na breast cancer ya.
We have the 0 stage.
0 no pekbantonye no pekmenye na reko.
Where the cells are within confined in one breast.
The Bema ya na mekao lawa kalao le enola tontome.
So that's when it is being identified early. The person has a 100% chance of survival.
Amema Luciano atan ko agbe. Ela bejo kaba.
And when we have the stage 1, they said the cancer in the breast tissue tumor is less than 1 inch in size. And the person has 98% survival rate. Stage 2. The cancer in breast cell, the tumor is less than 2 inches across the size and may spread to the axillary, that is in the armpits. So this one, the person has 88 chance of survival. Stage 3. Tumor is larger than 2 inches across the side and then the cancer has spread to the axillary. So this time, the cancer has started somewhere and has spread into your armpits. At this stage, most people start to show the signs and symptoms we just mentioned. Then stage 4. This one, there is nothing we can do about it. The cancer has spread beyond the breast and other nearby organs. But still up of 100, about 16% are likely to survive. So that means it only depends on early detection. When you are being identified as a what breast cancer patient, does not mean that is the end of the life. So we should come out and know ourselves. When you see any changes, anything unusual, report. What are some of the treatments we do when we identify something like this? There is surgery. So if the cancer cells are within the lungs or any tissue in the breast, they can just take the lump out of it, just like that. So that is why they need to go and do what we call CT. That one will be able to tell whether you are in the stage 1 or stage 2 or even the 4. And then there are chemotherapy. They can put you on medications. And there is radiation too. We have something called targeted treatment, where they identify the cancer cells and then they put you under a particular machine to go directly to kill the cancer cells. But if the whole breast is affected, they can take out the breast, which is the mastectomy. They can do a reconstruction for you. Reconstruction. You can put back another form of breast.
Very cool, but you might be a day. If I feel me, Mr. Bay, a chido, I don't know what no. Let me, yeah, custom, I put it this year.
So she's saying that you mentioned the fact that sometimes you see some discharges in the nipple. What will cause such nipple? What will cause such nipple? And how would you know it's also cancerous?
What will cause
such discharge? Sorry. Such discharge from the nipple.
Cancer or something. It could be an infection. As a woman, we have discharges in our vagina. No woman's vagina is dry. This is what we were talking about, help in the lubrication of the vagina. Other than that, as a woman, if you are going to have sex with a man and your vagina is dry, you are going to get bruises. Yes, we midwives, we take things as it is. Yes, so all we need to do is to run further investigation to confirm whether it is an infection and we can treat. But let me take this opportunity to educate, since she has already asked. As a woman, you're not supposed to be putting in chemicals in your vagina. The vagina itself washes itself. We have something we call normal flora in the vagina, which protects the vagina itself. So if they are putting other things, you tend to distract the action of these normal flora, and they can cause you so many infections. There is something they call in my language that tire matter. They buy certain things to put in there to make your vagina sweet for a man, and it can predispose you to so many other infections. We have endometrial cancer, we have cervical cancer, we have All of these things can cause problems. So desist from all these things to be on the safer side. Whether you like it or not, as you grow, your vagina will change. So don't try to make it tight for a man who will end up leaving you and go for another one when you develop conditions. Yes. Yes, please. Please, is that okay? Alright. We are about to end for the screening, but before I end, I have a story for you. There was a woman who reported to the hospital from where I used to work. She was so worried with the case. The children brought her to the hospital. She was very worried because her mother had recently died of breast cancer. When we did the examination, we realized she was having the lump in the breast. So quickly we referred her for a scan. Then other tests which confirmed that it was really breast cancer. But the fortunate thing was that when they did the CT, it was noticed that she was on stage 1. They quickly did the surgery and took out the lump and placed her on some medications. Do you know the good news? She is fine and alive. What is the lesson in here? Early detection saves lives. Thank you so much.